Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, our discussion is all about the HPV vaccines, right? So until now, we have discussed everything about these cancer cervix, starting from the HPV, what is HPV virus, and we have discussed what are the pre-malignant lesions in cervix, the various gynecological procedures followed by the cancer cervix and its management. Now, we'll be discussing about the HPV vaccines. So we all know that the most common cause of cancer cervix is human papilloma viral infection. But not just the cancer cervix, but also it can cause several different cancers such as cancer cervix, cancer vagina, vulva, oropharyngeal, anal cancer, penile cancer. It can also cause genital warts, laryngeal papillomas, and etc. So because of that reason, it is very important for every single person, not just female and male, everyone has to receive this vaccine, because even in male population, there are increased chances of oropharyngeal cancers, anal cancer, penile cancer in females, cervix, vagina, and vulva is common. So for that reason, both males and females have to receive these HPV vaccines, which will prevent them from getting this HPV infection, which will later on lead to causation of several different cancers as well, right? So this is a very important module, which is not very important not just only for the medical students, but for every single person. It is very important, right? As a growing young doctors, it is our single responsibility to make this awareness to every person available, right? So I hope that after learning the topic, you have to go to your parents or your friends and please explain to them the importance of these vaccines and the major role played by it, right? So now we will discussing about the HPV vaccine. So let's start with the discussion. So can someone remember, while discussing about the HPV virus, I told you please remember about the L1 major capsid protein of the HPV virus, right? So now we are going to take that into consideration, because this vaccine for HPV infection is actually prepared from the L1 major capsid protein, because the early genes and we know the late genes. The early genes are actually situated in the basal or the parabasal layers, right? In the basal or the parabasal layers, and the late genes, that is the L1 and the L2, are situated in the superficial layers, right? Yes, so from this L1 major capsid protein, the HPV vaccine is produced. Now, what is the use of a vaccine? What is a vaccine first? See, vaccine is a substance which you are going to inject into any patient, right? So once you are going to give this to any person, it is going to result in formation of antibodies against the specific antigens. So you are going to inject the antigen and you are going to induce antibody response in that patient. So once these antibodies are formed in the blood of the person, right? Once the antibodies are formed against a specific infection, then they are immune to that infection for that set peculiar period. Is that clear? Right. See, vaccine is a substance, right? Let me show you here. Vaccine is a substance where the antigen, either in the live or the inactivated form, in a proportion which is not going to cause a very live infection in the patient, right? So this is actually a live or an inactivated antigen which you are going to inject it into the person, and in this person's body, antibodies are going to form. So once these antibodies are formed, then these patients are immune against the infection. That is, they are resistant to this infection for this set peculiar period, right? So let's say, for example, if you get this vaccine is effective for the next 3 years. Okay, so during these 3 years, the patient is immune against this infection. After 3 years, you may have to repeat the dose when required. So that is the proper definition of this vaccine. So having discussed about what is vaccine, now we will get into the details of HPV vaccines, right? Okay, so the HPV vaccine is majorly prepared from the L1 major capsid protein. Now you tell me whether it is a live or an inactivated form. HPV vaccine is an inactivated form. It is not in the live form, it is in the inactivated form. Is that clear? Yes. Now, whether this HPV vaccine is light sensitive or not, it is a light sensitive vaccine. So you need to protect it from the light. So this vaccine is very sensitive to light. So because of that reason, you need to store it under a condition where it is protected from the light. So it is an inactivated vaccine, light sensitive vaccine, and it has to be stored at around 2 to 8 degrees Celsius in the refrigerator. Between 2 to 8 degrees Celsius. Now, what is the route of administration of this vaccine? This is administered through intramuscular route, right? Through the intramuscular route, this is administered. And what is the dose? It is about 0.5 ml per dose. 0.5 ml per dose. Now, what is the site of administration? It can either be administered in the deltoid, right? In the deltoid of the upper arm, or it can be given in the anterolateral aspect of the thigh. Anterolateral aspect of the thigh. Deltoid is still more preferred than the anterolateral aspect of the thigh. Okay. So now we have discussed about the basics of this HPV vaccine. So having discussed this, now who has to receive this vaccine? So who are the actual persons who need to get this vaccine to stay immune? So the ideal age is around 11 to 12 years. So any male or female between 11 to 12 years, they have to receive this vaccine. But then we have a specific age group criteria. So between this age to this age group, it is more effective, and that is around 9 to 26 years. So between 9 to 26 years, any male or female can receive this vaccine. Is it clear? Between 9 to 26 years, any person can get this vaccine. To be even more specific, between 11 to 12 years is the ideal age group to receive this vaccine. But in a broader sense, it is 9 to 26 years. And this vaccine, if taken by sexually inactive person or any person before entering into the sexual life, if they get this vaccine, it is said to be even more effective when compared to the same vaccine administered in a sexually active patient. But still, there are certain beneficial effects if this vaccine is given to any sexually active person. But then in sexually inactive person or any patient before entering into the sexual life, if they get this vaccine, it is said to be even more effective than the effect which is observed in the sexually active patients, right? Okay. So now you tell me why it has to be received. It has to be received because in females and in males, it causes several different cancers. As we have discussed, it causes cervical cancer, vaginal cancer, vulval cancer in female. In males, it causes oropharyngeal cancer, penile cancer, anal cancer. It can also cause genital warts, the lower subtypes. Yes. So because of that reason, it is very important for both the males and females to get this vaccine. Right? Okay. So now, can we give this vaccine during pregnancy? No. HPV vaccine is contraindicated during pregnancy. But if a patient has taken HPV vaccine and she has to plan her pregnancy, it is said that if she is going to delay her pregnancy by 3 months, it is well and good. So if she has received now HPV vaccine and she is planning pregnancy and she is asking you whether I can plan my pregnancy, you have to ask her, please delay your pregnancy for the next 3 months and then you can plan your pregnancy, because there is no any desired effect caused by this HPV vaccine. But still, to be on a safer side, you advise the patient to plan their pregnancy after 3 months. Is that right? Okay. Can sexually active female receive it? Yes, they can receive it, but it is most effective in the sexually inactive patients, right? Okay. And what is the side effect of this HPV vaccines? The most common side effect, please remember, it is syncope. Syncope is the most common side effect of HPV vaccination. Okay. So we have discussed about HPV vaccines and when you have to start, when you have to like 11 to 12 years is the ideal age. What is the age group in a broader sense? It is between 9 to 26 years. But now you have to remember that after 26 years, will you be able to give it to any patients, or you should not give to any patient after 26 years? The answer is you can give more than 26 years, that is from 27 years to 45 years you can give. But in whom? But in high risk individuals. Any patient with high risk, you can administer them between 27 to 45 years. Not routinely it is given between 27 to 45 years. Please remember, it is given only in those patients who are high risk of having these cancers, cervical cancer. In those patients, you can give between 27 to 45 years. Why not after 45 years? Because the mean age for cervical cancer is around 50 years. So giving it after 50 years is almost ineffective, or it nothing makes any sense, right? So for that reason, between 27 to 45 years, you can give to patients with high risk of having this cancer, right? Okay. Now, what is Cervavac? Cervavac is the first vaccine which was prepared in India against cancer cervix. Is that clear? Against cancer cervix, the first vaccine which was prepared in India is Cervavac. And the Cervavac is a quadrivalent vaccine. What do you mean by quadri? Quadri means 4. So it protects against the subtypes 6, 11, 16 and 18. Right? 6, 11, 16 and 18. 6, 11 causes genital warts, 16 causes oropharyngeal, right? Anogenital, cancer cervix, and 18 also causes cancer cervix. So because of that reason, it is protective against 6, 11, 16 and 18. So it protects from both the cancer cervix and genital warts as well. But now, the Cervavac, which was the first vaccine in India, produced in India against the cervical cancer, it was prepared in the Serum Institute of India. Where is the Serum Institute of India situated? It is situated in Pune, right? It is situated in Pune, right? So it is a quadrivalent vaccine which is effective against HPV 6, 11, 16, 18 subtypes. So it is a quadrivalent vaccine. So let me show you the image here. So can you see here? This is the Cervavac, the quadrivalent vaccine, which is effective against the subtype 6, 11, 16 and 18. Right, as you can see here, the dose is 0.5 ml. And they have given here that between 9 to 14 years, 2-dose schedule at 0 and 6 months, 15 to 26 years, 3-dose schedule at 0, 2 and 6 months. So for this Cervavac vaccine, it can be taken between 9 to 26 years, as we have discussed, between 9 to 26, and the dose varies between these 9 to 26, that is between 9 to 14, it is 2 dose. Between 15 to 26, it is actually 3 dose. Is that clear? Yes. And the 2-dose schedule is at 0 and 6 months. And the 3-dose schedule is 0, 2 and 6 months. Clear? Yes. So this is all about the Cervavac, which was prepared in the Serum Institute of India, Pune. And you may have the doubt, what is the actual dose of this quadrivalent vaccine, right? It is a very important point, but it is not, it is not asked so frequently, but it is very good to know this, right? So it is around the L1 protein against the serotype 6, 11, 16 and 18. So for 6, it is 20 microgram. For the 11 subtype, it is 40 microgram. And for the 16 subtype, is again 40 microgram. And the 18 is 20 microgram. So the human papilloma virus type 6, 11, 16 and 18, it is present in a concentration of 20, 40, 40 and 20. You can remember it like 6 and 18 are 20, 11 and 16 are 40. So it is 20, 40, 40, 20. Is that clear? Okay, so this is all about the Cervavac. Now, we have a separate WHO dose recommendations. So what are the WHO dose recommendations? WHO tells us that between 9 to, unlike the recommendation which was given for Cervavac, that is between 9 to 26 years, you divide them into 9 to 14 and the further into 15 to the 26, right? So the first was 2 doses, and the 15 to 26, it is between 3 doses. 2 doses at 0 and 6 months, 3 doses at 0, 2 and 6 months. But here WHO tells that between 9 to 14 years, you can give either 1 or 2 doses. Between 15 to 20 years, you can give either 1 or 2 doses enough. Either give 1 dose or 2 doses. But more than equal to 21 years, either 21 or more than equal to 21 years, you definitely have to give 2 doses. There is no choice here. Between 9 to 20 years, either give 1 dose or 2 doses is also fine. But when the patient is 21 years or more than 21 years, you have to give 2 doses. And the interval between these 2 doses is about 6 months interval, right? With 6 months interval between the first dose and the second dose, the interval has to be 6 months, right? Okay. And to be even more specific, right, whether HIV positive patients can get this cervical cancer preventing HPV vaccine, yes, they can receive HIV positive patients can receive this HPV vaccine. They can receive this HPV vaccines. Okay. But the dose is going to be 3 doses, not 2 doses. It is going to be 3 doses. So WHO tells that between 9 to 20 years, give either 1 or 2 doses. 21 or more than 21, you have to give 2 doses at an interval of 6 months. HIV positive patients, you can give HPV vaccines 3 doses. Is that clear? Okay. Now, what about the screening? We all know that as a protocol for screening cervical cancer, we do a test called HPV DNA. And we did visual inspection with acetic acid, right? So these are the various screening methods which are suggested by the WHO. So WHO tells that you need not and you have to. What does need not and you have to? You need not screen the patient, that is, you need not do HPV DNA testing to any patient before giving HPV vaccines. So if any patient comes to you for getting this HPV vaccine, please don't screen that patient whether HPV DNA is positive or not. Irrespective of the status, give HPV vaccine. But after administering the HPV vaccine, you have to screen the patient. That is, routinely as you screen every other patient, you have to start the screening. Since the patient has received the vaccine, you are not going to stop the screening. You have to screen like in every other normal person. You have to start the screening irrespective of the HPV vaccine which was administered. So before administration of HPV vaccine, you need not screen. But after HPV vaccine administration, you have to screen like in every other normal person for the set particular period of time. Is that clear? Okay. So now we have discussed about everything about the HPV vaccines. Now the most important is this table. What are the vaccines? So the vaccines which are available are Cervarix, Gardasil, Gardasil 9, of which the most commonly used and the most commonly available is the Gardasil 9, and the most commonly used is also Gardasil 9, right? Okay. So Cervarix is basically a bivalent vaccine. It is a bivalent vaccine. Gardasil is a quadrivalent vaccine. Gardasil 9, as it signifies 9, it is a nonavalent vaccine. Bi means 2, quadri means 4, nona means 9. 2, 4 and 9. So it is against the HPV subtype 16, 18. Gardasil is against 6, 11, 16 and 18. But Gardasil 9 is against 6, 11, 16, 18, 31, 33, 45, 52, 58. So 16 and 18 means it protects against cancer cervix. 611 it protects against genital warts. 16 and 18 is CA cervix, right? 6 and 11 is genital warts. 16 and 18 is cancer cervix. So 16 and 18 cancer cervix. 6 and 11 genital warts. 16 and 18 cancer cervix. And here 6 and 11 genital warts. 16 and 18 cancer cervix. 31, 33, 45, 52, 58 is the other cancers which are there. such as the vaginal cancer, vulval cancer, anal cancer, penile cancer, oropharyngeal cancers, all these cancers. So definitely one single vaccine which is most commonly available and it is effective against all the 9 types of cancer is Gardasil 9. So because of that reason, Gardasil 9 is the most commonly used type of vaccine. Is that clear? So until now we have discussed about everything about the HPV vaccines, Cervarix, Gardasil 9, and the one which is the India's first prepared cancer cervix vaccine is the Cervavac. Right? So we have discussed everything about the HPV vaccines in detail. I hope everything was very clear to you, right? So please take yourself or your sister, your brother, your sister, your mother, anyone who is in this age group, right, and who have any specific risk factor being present, please take them to a gynecologist and have them vaccinated. So how much probability we are going to cover up with this vaccination, so much you can prevent the incidence of cancer cervix in the women, right? So oncology is a particularly highly demanding field now, and the incidence of cancer is increasing day by day, as we can see now. So please advise your friends, your family, and every single patient to get vaccinated and be immune against this cancer cervix, and let's fight against them. Okay, so please keep studying until let's meet in another interesting module.